Tucker Carlson's persuasive. All right. Do you know who this is?
Taylor Swift's boyfriend.
Taylor Swift's boyfriend. Anyone know him from anything else?
Travis Kelce.
Travis Kelce. There we go. So, you might know him as a football player or Taylor Swift's new boyfriend, but I know him as a sellout. Recently, you might have seen him in his new Pfizer commercial where he was paid over $20 million to appear in. Now you might just be thinking, well, this is harmless, it's a commercial, what can it do? Well, Travis has blood on his hands. Kind of jokes, not really. But companies such as Johnson & Johnson and Pfizer have skyrocketed drug prices, leaving people helpless and vulnerable, or worst cases, death. As pills themselves are not harming people, the prices are. The government has taken steps forward to combat this by enacting change such as the Inflation Reduction Act, which helps support people through making the companies pay for the rebates if they raise prices past inflation. Ariel Bosworth and Stephen Singold write in their article, Changes in the List Pricing, the Prescription Drugs, published this past October on the ASPE website. Over the period of from January 22nd to January 2023, more than 4,200 drugs products had price increases, of which 46% were larger than the rate of inflation. The average drug price increase over the course of the period was 15.2%, which translates to $590 per drug product. Even with support from the government, these companies have way too much power and control over the market to set their own prices. Even Americans desperate during these times. The companies know that they can do whatever they want with a large majority of the different products and their drugs being controlled by their patent protections. Also, since the companies in the US are so few, they collaborate and set the drug prices so high as to not compete with each other. S. Vincent Ragmar writes in his article, The High Cost of Prescription Drugs, published June 23rd, 2020, on the NIH website, high prescription drug prices are sustained by the fact that treatments for serious disease are not a luxury item, but are needed by vulnerable patients who seek to improve the quality of life or to prolong life. A high price is not a barrier for serious diseases. Patients and their families are willing to pay any price in order to save or prolong life. For these desperate cases, loved ones are willing to do anything. And I think anyone here would do anything for a loved one who is struggling. The drug companies know this and take advantage of the situations that many families are in, knowing full well that they have to go to them to be able to pay. But as this is dangerous for people financially, it is also dangerous for people medically. People will become so desperate, especially in lower income families, that they will not even try to buy the products in the first place. Zachary Tracer writes in his article, millions of Americans were skipping doses, published this past June on the Business Insider website. Unfortunately, people without health insurance and those with lower incomes were more likely to skimp on their prescriptions, 22.9% of them of who's without insurance, and 14.5% of people whose incomes was below the poverty line and did not take their medications as prescribed. Similarly, 18% of those people in fair or poor health sometimes skimped doses or delayed fillings of their prescriptions to cut costs. People are more willing sometimes to not even get the drugs that will save their life than to pay outrageous out-of-pocket prices. They would rather suffer with money than be completely broke and in debt to these companies. Either way, people are getting desperate. And it is leading to an epidemic of people losing their lives. These desperate situations are especially hitting the elderly community hard, as they are the ones that are majority taking these prescription drugs. The researchers at the CIDSA write in their article, High Drug Prices and Patient Costs, published on November 18, 2020 on the CIDSA website. Over a 10-year period, high out-of-pocket costs for drugs are estimated to cause 1.1 million premature deaths of seniors in the Medicare program and lead to an additional $177.4 billion in avoidable Medicare costs. In essence, 1.1 million lives are being prematurely lost because these companies would rather steal every nickel and dime from these elderly people than cut costs and let them live. But this is what happens within our own country. Let us look north to Canada. They have something there that is called Universal Health Program. Universal healthcare, but it's something very different from our own. Emma Baldwin writes in an article, U.S. prescription drug costs, published this past September on the MedCity News website. Such changes lead patients to seek alternatives, and increasingly American patients are looking to Canada, which regulates drug prices for more affordable prescription options. These prices over the border can sometimes be up to 90% less than the same drugs stateside. Now, I'm not saying that we should change this model that we have in our own country, but as we can see, there are options to this problem within our own country. So that us as U.S. citizens do not need to travel abroad to be able to afford prescription drugs. Thankfully, there are not-for-profits out there that are willing to help. The Healthwell Foundation is combating high drug prices within our country by helping people with certain life-threatening diseases to be able to afford life-saving drugs. These people at the Healthwell Foundation write in their mission, last updated this past June on the Healthwell Foundation website. In 2022, we awarded more than $896 million in grants through our disease fund. And since 2004, we have helped more than 822,000 patients afford essential treatments and medications. Unfortunately, this not-for-profit is catered towards the middle class and lower middle class, which are people that usually can afford health insurance in the first place. Which people that are hurting the most sometimes are the people that cannot even afford health insurance. But this not-for-profit is still helping thousands of people around the country. As there's no specific solution to this problem, nonetheless, it is a problem, and Americans are dying every year because of it. You can support people in need through donating to companies such as the Healthwell Foundation and to nonprofits, voting for politicians that will put you first instead of Big Pharma. But the greatest thing is to be informed, because not many people seem to know or care about this problem that's happening around our country. So, don't be like Travis Kelce and be bought out, but instead, join the fight against Big Pharma.